Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Hey, everybody. Welcome back to the Wild Health Podcast. I'm here with my good buddy, Mike Stone. This is Carl Seeger. Good to be back, and we're going to talk about some articles. How's it going, Mike?
It's good. It's good. You know, we promised we'd follow up to the idea of annoying articles, and you know, the article itself might not be that annoying, but I promise there's an annoying spin that we can highlight.
Yeah, I think we should talk about this. It's a recently published article from JAMA. It's about the consumption of olive oil and dietary quality and risk of dementia-related death. And so this article it's a study that involves 92,000 participants. It's tracking olive oil consumption and daily quality over 28-year span. And the researchers found that consuming more than 7 grams of olive oil per day was associated with a 28% lower risk of dementia-related death compared to those who rarely or never consumed olive oil. So these findings persisted even after adjusting for various confounders, including diet quality, physical activity, and genetic predispositions to dementia. So, Mike, tell me what you think the key findings are, and then we can maybe get into what is annoying about this.
Yeah, absolutely. This is a really well conducted study. I just want to say that they did a phenomenal job on this. It has many of the same limitations that we see in any sort of longitudinal cross-sectional study of people followed over years, especially when you get into lifestyle behaviors, right? So every 4 years, they used a food frequency questionnaire. And as part of that questionnaire in this, almost 100,000 participant cohort, they categorize people as never using olive oil, like never or less than once a month, greater to 0 or less than equal to 4.5 grams per day. How they're assessing this on a food frequency questionnaire, I don't know. Just for setting the stage, 7 grams a day is about a teaspoon and a half. Yeah. Okay, so half a tablespoon of olive oil. So first things first, if you wanted to just run with the TLDR of this article and start making sure you had some olive oil in your diet, 1.5 tablespoons, you can stop listening, go to the grocery store, and there you got the take home from the study. And what was cool about this study, aside from the fact that it was well conducted and followed over many years, is how much they corrected for some confounders, as you mentioned, right? So it's one thing if you looked at olive oil consumption and didn't account for dietary quality. And people who were eating olive oil were also buying organic foods and eating a whole food plant-based diet and eating Mediterranean. And people who were using margarine or butter as a fat were going to McDonald's and the drive-thru and In-N-Out Burger. Then maybe it's not the olive oil, right? But in this case, they did a decent job of confounding level of education, socioeconomic factors, and healthier diet overall. Other limitations predominantly a study of non-Hispanic white participants, not necessarily generalizable to a more diverse population. They didn't differentiate among different types of olive oil that can differ in polyphenols and non-lipid bioactive compounds. So they're not, this is not a proven causation study. Nobody says, and nobody should take away from this study, if I eat 1.5 tablespoons of olive oil every day, that's going to make me not die of dementia. There's an association. There's a link there, and how much of it is the olive oil itself versus how much of it might be, hey, people who are health oriented know about olive oil and also do 150 minutes plus of moderate exercise a week, and also do resistance training and spend time with their communities. And I mean, there's so many things here that it's an association study. But what was new and different about it is, as opposed to every study like the Mind diet or the DASH diet or the Mediterranean diet, is they did correct for overall food quality. And there's definitely some association with olive oil itself with reducing long-term dementia related death, which I thought was pretty cool.
Yeah, I mean, I think I think they did a great job. Like, I was reading this article going, oh, this is really great. However, let's talk about what happened in sort of popular media then, and how things that kind of taken and maybe is hyperbolized a word? Can you hyperbolize?
Yeah, sure. I mean, it's our podcast, Carl.
Hyperbole.
We can have any word we want.
Good. So there was just some hyperbole from there. So, so CNN, ABC picked this up, Washington Post picked this up. And, what I read from all of these is basically go eat olive oil, and you will not have dementia and your risk of dying will decrease. Is that what you read when you read those articles?
Yeah, I mean, this is the annoying spin. The annoying spin is what happens when like really high quality, well framed, frankly humble and appropriate scientific research gets picked up by the popular media. Is it gets turned into this simplified health advice to, eat this or do this or don't eat this or don't do this, and then you're going to be healthy. And ultimately, we need to move away, in my opinion, from this like reductionist health advice and celebrate and embrace the complexity of human health, which involves, a lot of diverse dietary patterns and regular physical activity and mental well-being and spiritual connection and community and all these other things that we know come into play. And anytime I see a news headline that says, blank, the new superfood, or, butter, it's back, or, coffee is amazing, or whatever. I think, that's how this article made it to the Annoying Articles podcast. No fault of the article or the study authors or the study design or even the publication. Like, it's a great study. It has its limitations. They address them. It's got some interesting findings. But it's this, quick hack sort of mentality around health that we have as a culture in the media, where we're not talking about the hard things, right? And let's leave out, what's left out of that study is olive oil is expensive, right? Like, there are many people where this is not an option for them. And it's certainly not the one health hack that's going to help them live a long time. And then if I can stay on my soapbox for 20 more seconds, olive oil is not a whole food. Like, olive oil is a processed food. You want to make sure if you're getting it, you're getting like single source, you're getting it cold pressed, it's extra virgin olive oil. It does have polyphenols. There is antioxidant effect from olive oil. It can be an interesting, it can be couched as a health food. I'm okay with that. And at the same time, it's highly caloric. And there, like anything, including water, there is a point at which it becomes clearly not good for you. So what I would caution people when they see news media outlets, news stories like that, I always worry somebody's going to go out and be like, well, if 7 grams of olive oil is good for me, I should probably put like 3 or 4 tablespoons on dinner. And you just added like 500 calories to your dinner, and go ahead and do that for, like 4 or 5 months, and you may turn around and be like, I don't really know why I'm 15 pounds heavier than I was when I read that cool article.
Yeah, no. So this actually happened into a patient of mine that may or may not have been a family friend / relative, that they took this article, and instead of integrating olive oil into their cooking as opposed to other types of oil like canola oil and things like that, they just took it as, I'm going to eat what I normally eat, and I'm going to do a spoonful of olive oil every day. And that is not the takeaway. But if you look at CNN, it says, it starts out as a daily spoonful of olive oil could lower your risk of dying from dementia, according to a new study by Harvard scientists, which right there on its own, like if, for the lay public, like that's what some people take away.
Oh yeah. Harvard says I should take a shot of olive oil in the morning.
Those Harvard doctors.
Those Harvard doctors. I mean, they're amazing. Just incredible. Yeah. Shout out to Brigham and Women's, where this was IRB approved.
Well, and we can make a little jokes because Mike Stone actually worked at Harvard and was a professor there, and so I can make little jabs at that. But that's
I'm brushing off my shoulders right now with pride. I mean, I think we that to me is the this is what worries me about people getting their health advice from frankly from podcasts, from blogs, from popular media, right? I mean, it's always a small piece of the picture. If you want somebody to click on your article, it's got to have a catchy title. And I think this is a real problem, right? Is this oversimplification, this reductionist approach? What do I take away from the article? If you're looking to add oil to your food, olive oil is almost certainly the right oil to be adding. And that there are probably some benefits. Half a tablespoon of olive oil, just for the record, it's like 60 calories, right? I mean, you're not talking about a big caloric load. I definitely, I mean, for listeners always end up wanting to know, well, like, what do you do? And patients always want to know, what do you do? Yes, I eat olive oil. I mean, I'm not like taking a shot of it if I didn't have olive oil on something like a salad over the course of the day. But yeah, I don't think of olive oil as being a bad or unhealthy food. But I certainly wouldn't be treating it like a bulletproof coffee version of olive oil and waking up and having an extra shot of olive oil or putting it into something you'd never imagine putting it into, like, taking your macadamia nuts and drizzling olive oil onto them or something. Like, don't go crazy, people. One cool thing I did want to mention on this study was the odds ratio for dementia-related mortality based on ApoE4 allele dosage, which is really cool because we talk about ApoE4 alleles. And yes, for people who are interested in dementia risk and genetic-related dementia risk, ApoE4 talk has been around a long time. We're also getting into the whole Klotho discussion and a bunch of other genes that impact our dementia risk. But historically, ApoE4, if you had one copy of an ApoE4, you were thought to be about 3 to 5 times more likely to develop dementia, and two copies, 4 like 15-fold more likely, like almost genetically predetermined. And that may be true. I mean, this is one study, but what's interesting is, like, do you have dementia or do you have like capital D dementia, where like you're dying as a result of your dementia? It's really incapacitating and high morbidity to the point of becoming dementia related mortality. And the odds ratios in this study, 100,000 people, a lot of people had dementia, 25,000 or so had, or 27,000 people that were included in the genetic subsample. And if you had one ApoE4 allele, your odds ratio was like 1.7 to 2.3 for developing, for having a dementia related death or dying with dementia as a diagnosis. So
yeah, so just for the double. Audience. Yeah, so just for the audience, so odds ratio is a measure used in statistical analysis to quantify the strength of an association between two things, basically.
Yeah, so if you have an odds ratio of 1, it's the same as the two things have the same odds of developing. If you have an odds ratio of 2, it's twice as likely. An odds ratio of 0.5, half as likely, and on and on. And so for one ApoE4 allele, 1.7, depending on whether they looked at the national health professionals follow-up study or they were looking at the nurses health study, anywhere from 1.7 to 2.3 for one allele, and anywhere from 5.3 to 9.5 for 2 alleles. So that correlation still exists, but it was interesting to see that it was a lower a lower odds ratio than some of what we're familiar with in the other literature around ApoE. So, definitely additive. One allele not as bad as having two alleles. Neither of them is as good as having no ApoE4 alleles. But I thought that was just, they didn't focus a ton on this. It was sort of a side sub-analysis in their olive oil masterpiece. But just something I thought was worth mentioning.
All right. Did we cover this?
I think we did. Yeah. If you see anything that says, this food's back, or this is what you need, or add this to your diet if you want to live a long time or not die of X, Y, or Z condition, just, take it with a grain of salt or a shot of olive oil.
Shot of olive oil. Yeah, I think the take home is that there's nuance to all these things. Having a discussion around it and understanding the context is always important.
And, just flat out plug for working. It doesn't have to be with us. Work with a health professional, work with somebody who knows what they're talking about and who really lives in this space, because, we've all seen so many folks come to us with just, ridiculous levels of confusion of, I heard this on this podcast and read this in this paper and this article came out. And if you're trying to, it's like reading, Car and Driver magazine and then going to try and fix your car. You'll learn some cool stuff and it's really interesting, but that doesn't really put you in the position to be a qualified mechanic. And similarly, I would say micromanage. There's been a movement to manage our own health. And health and wellness being up in the forefront of popular media is a wonderful thing for increasing awareness. And at the same time, it can be really overwhelming and there's a lot of misinformation. So have somebody in your life who you can talk to who knows how to critically look at these kinds of studies and claims and can hopefully help translate some of it into something practical.
Okay, man. Thanks, man. Thanks for talking with me.
Awesome. Thanks, Carl. Take it easy, buddy.
Bye.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.